Hello, my name is Sarah Maxwell. I'm the Director of Marketing at ThriveAP. At ThriveAP, we are honored to have an expansive faculty of expert speakers and advanced practice providers with impressive credentials and experience. Today, I'm going to take a few moments to get to know one of our speakers a little bit better and gain some of their advice for thriving in an advanced practice career. So thank you and welcome, Shawna Harney.
Hi, thank you for having me.
Thank you for joining us. I would love if we could start by just getting to know you a little bit better. Can you tell us a little bit about yourself, your background, where you practice?
I'm a family nurse practitioner. I started my career as a nurse practitioner with ThriveAP when it was mid-level U and was one of those first cohorts in primary care medicine. Before I worked in emergency medicine and trauma centers as a RN for about 8 years before. And then when I came out, wanted to really transition into preventative medicine and, help prevent those ER visits, and was placed at a FQHC with the help of the residency program. Did that for a year, and I was in Oregon at a migrant health center. Had a great, with the help of my mentors, with the help of this program, was able to really set up a foundation to move forward. At that health center, I was doing migrant healthcare. We did mobile healthcare and school-based healthcare along with like the traditional clinic. So that was really great. I could use my emergency skills and urgent care skills for acute care. I also started working PRN to build those skills out even more at emergency department with my nurse practitioner, and along with some urgent care as well. Then moving from there, when COVID pandemic shifted everything for everyone, we started doing outside health clinics and offering care to everyone that we could, and trying to continue that prevention. So that was a project in itself. And then my family made the decision to move closer to home, which is for us at St. Louis is close. So we looked into that, and I got a job at the VA. And one of my passions in primary care was endocrine and working with patients, just since it's such a broad multi-system specialty, that I ended up getting offered a job in the specialty. So I've transitioned into that, and that's been really an exciting, I've learned so much working in endocrine. I also continue to work in urgent care because I just the VA, we don't see many kids, and I miss seeing kids. I also like to keep my skills up, and so I've continued to work in an urgent care setting and doing everything I can for that. I still, I really have a passion for underserved populations and bridging the gap in health education. That's really what I kind of try to do and strive. Now being part of Thrive and being able to, give back to what I had in that first year of residency is, really exciting. I'm having a great time doing that. I think it's something that, our physician assistants and nurse practitioners aren't always, given that support. And so many times it's just really unfair because that first 6 months to a year is just so overwhelming. So I think having the tools and resources and just even that, that confidence boost by having a team around you is really fun to be part of.
Absolutely. Well, and you brought up a couple points there. One, I don't think I realized that you had actually gone through our original program. That's amazing.
Yeah, it was fantastic. Being able to have that and the camaraderie of the other new grads was really great too, because I was the only one in my clinic setting. Eventually they brought on new grads, but to just be able to have that and have someone to call during those first few weeks when you just don't know what to do, like at the end of your day, and you don't have that, no one else is in the clinic anymore because you're just still there. So having those mentors that are connected through Thrive was just fantastic.
Total full circle.
Yeah.
Well, and you also spoke a little bit about this already, but you started to touch a little bit on your passion. I would love to know, kind of what are you most passionate about in your current role?
I think currently it's just connecting, building connections with patients and then being able to give them the tools, like work as a team. I think that's what I always try to think of in my practice. Like I'm standing alongside them, like guiding them in their decision making and giving them that information that they didn't have before about either their chronic disease or their acute care management that I see them in just a brief, moment. I think that's the opportunity. Maybe that's the only person they're going to see the whole year for their healthcare. So I think I find that, the most passionate to use those opportunities. And because ultimately, just, at the end of the day, it is prevention and trying to keep people out of the ERs and, with a better quality of life.
Yeah, absolutely. And is that kind of what attracted you to joining the faculty at ThriveAP, or were there a couple of factors?
Yeah, I think that setting up other nurse practitioners and physician assistants for success, because it is, especially during the last few years, is such a burnout, pandemic, epidemic. So everyone is having a difficult time. And I just think if we can support each other, then we'll be able to do better for our patients and our populations and everything too.
I swear every time we do one of these interviews, I end up saying this, but it's always so true. It's been really fun for me to get to know our faculty because you really get this sense of camaraderie of the desire to give back to your fellow APPs and to help build the next generation and guiding from your experience. And I think that's such a unique, a unique aspect of the career and of the role.
Yeah, it's very special place to be part of.
Yeah. Well, speaking kind of that, of supporting your APPs and the next generation, when you think about maybe who your mentors were or what you think, the mentors of today should be, what do you think those key attributes are?
I think that, what we're looking for in mentorship is just having that experience, like as part of it. And I think that's, being able to give you real life explanations, having that time, which I think is important too, because you can have mentors, but not necessarily have the space and, to be vulnerable with them too. So I think that's important. And just, you have to find someone that practices in the same way that you practice too. So it's all, you kind of have to find where you click with that person as well. And usually that can be, I think, having more people around to support is the better, because then you can really find who you go to for certain things too.
Yeah, you can kind of find your right path and where you fit, so to say.
Yeah, definitely.
So do you have any favorite journals or resources that you use to make sure that you're kind of staying abreast of the latest procedures or updates in the space?
Yeah, I use UpToDate is a go-to, and 5-Minute Consult whenever I'm in urgent care. I use that typically to just as a resource. The Journal of Urgent Care Medicine, something that I kind of follow along. And then some Hippocrates, I kind of get updated on pharmacy and pharmaceuticals there. There's a lot of information in CME within the VA system and a lot of research that, I'm lucky to be part of. So that's I think a good place to be too.
And if you had to pinpoint maybe your most noteworthy career accomplishment, what would that be? And could you tell us a little bit about why?
I would say, I think during when I'm able to start a new process, I really enjoy process improvement that ultimately affects patient outcome. So one most recently, like doing a weight management work group within, so that we created a more multidisciplinary team for our endocrine center. So having an RD, a pharmacist, endocrinologist, myself, all working together towards one goal. And I think that made for a lot better outcome for patients. And that stemmed probably in my early career at the FQHC, the Hepatitis C program. We were seeing that patients were really falling out of that program. So I usually just like to see where the need is and then kind of go from there. But I think in that same way, it kind of set me up to be able to do these other programs too. So I think anything that can provide access and extension makes me very happy. So I feel proud of those moments.
Absolutely. I mean, it sounds like you're kind of innovating new processes that are, like you said, providing better care and more quality care for people who really need it.
Yeah.
Well, that's wonderful. And, I want to be very cognizant of your time today. So I just have one more question for you. What advice would you give to APPs of today so that they could prepare for a successful future and maybe follow in your successful footsteps?
I would say to just be open to creating relationships and learning from everyone around you. You want to ask questions and dive in definitely in that first year, say yes to opportunities, and you might be surprised at what you end up, loving and learning through that. So yeah, I think that's the best way to kind of propel anything.
No, that's great advice. I think, I've kind of heard it. You think, oh, I'm totally going to go down this specialty and this is where I'm going. And then suddenly, there's an experience in clinic, or there's an experience with a preceptor, or there's experience, just through a certain case, and suddenly it's, wait, I never thought about that avenue. So
yeah.
Saying yes and exploring that could be really career changing.
Yeah, definitely.
Love that. Well, with that, I think we've definitely taken up enough of your valuable time. So I want to thank you for being here with us today and sharing your incredible expertise.
Thank you so much. Happy to be part of Thrive. Thank you.
Oh, we're honored to have you. Trust me. And thank you everyone for joining us, and stay tuned to meet more of our faculty. Have a great rest of your day.